Story 1. The water content of bamboo is affected by the phase of the moon. Story 2. The illusory truth effect is when people believe something simply because it is repeated, even when they know it is not true. Story 3. When an amputee is experiencing phantom limb pain, massaging their stump and the area where the limb was can help reduce the pain, especially if the person is already on the maximum dosage of pain medication and cannot have any more. Hearing the hands against the sheets where the limb would be tricks the brain into thinking it is still there, which helps stop the nerves from overfiring as much. Story 4. Trying to describe otoliths or otoconia causing dizziness quickly in simple terms sounds a lot like quackery, especially when you start talking about the treatment as a natural set of exercises that will help you realign your inner crystals and regain balance. Story 5. Redheads need more anesthesia than non-redheads. This has always been fascinating to me. Story 6. The talk about you changing personalities when switching languages apparently has truth to it. Story 7. The effect on your dopamine receptors from fantasizing or imagining things is significant. Although I forget the exact term, it turns out that you can achieve a high dopamine response from fantasizing, imagining, or talking about goals. This can provide your brain with enough positive chemicals to actually hinder your drive to go and achieve those things for real. This sounds unbelievable, but it is true. Story 8. Neuroplasticity is amazing. Our brains rewire themselves to use new tools so we do not have to think as hard about using them. Picture writing your name and think about how your arm, hand, and fingers all move together to draw the letters. All that incredibly complex movement we do not even think about, our brains just do it. We can use tools like they are an appendage. Some people even learn to use new appendages or senses like the third thumb device developed to make life easier, or the person who implanted an antenna into his brain that lets him sense electromagnetic fields. Story 9. You absorb more nutrients from cooked eggs than from raw eggs. People often do not believe this because cooking eggs reduces the amount of nutrients. However, cooking changes the protein structures, making it easier for your body to absorb them. This process is called protein denaturation, and it increases the bioavailability of the proteins. Bioavailability describes the amount actually available for your body to digest and absorb. More nutrients do not necessarily mean more bioavailability, and fewer nutrients do not necessarily mean less bioavailability. Story 10. B.F. Skinner's air crib. In psychology, B.F. Skinner is considered the father of behaviorism. He wrote a science fiction book called Walden 2, which featured some of his ideas. What he is less known for today but was well known for in his time is his air crib for babies. It was basically a ventilated and climate-controlled box enclosed by plexiglass. It was padded but similar to a doctor's chair with paper that rolls out and is replaced with new paper for hygiene. Parents who bought and used one for their children loved it because their children were content and comfortable. However, the public and media thought it was crazy. They claimed Skinner was nuts and that the air crib was basically a terrarium for children. Skinner invented it because his research determined that the main reason babies become upset and cry, besides being hungry, is discomfort from being too warm or too cold. His research showed that if a baby has a perfectly controlled environment and is comfortable, it will not keep waking up at night crying, and parents will get more sleep. Additionally, since blankets and sheets were not needed, nor was the baby required to wear many clothes, parents did not have to constantly do laundry. Critics ridiculed the air crib, claiming it was a horrible Skinner box, which was a totally different device he used for experiments. They even invented stories about babies dying or growing up disturbed, and that Skinner's own daughter committed suicide as a result of being raised in an air crib. This is false because Skinner's daughter later said she was very healthy, alive, and had no horrible memories of the air crib. Ultimately, the interesting thing about the air crib is that it is a technological upgrade from the simple item most Finnish parents use. When a woman in Finland gives birth, she is literally handed a folded cardboard box. At home, they unfold it, put a little padding at the bottom, and that is it. No fancy elaborate crib, just a cardboard box. Finland has one of the lowest infant mortality rates in the world, 2.1 per 1,000 births. By comparison, the United States, Slovakia, United Arab Emirates, and Bosnia have nearly the same rate, around 5 to 5.1 per 1,000 births. You cannot really buy an air crib anymore because no company wants to be associated with the constant criticism of the device, regardless of how successful it was for many couples in the 1940s and 1950s. However, you can build one yourself. Story 11. Benign paroxysmal positional vertigo treatment is amazing to me. Many things in physical therapy require a lot of time and effort, such as exercise and lifestyle changes, but benign paroxysmal positional vertigo treatment involves a series of head rotations and observing eye movements, and vertigo is cured. It seems almost magical, and it is the closest thing to magic I have seen in my career. Story 12. Seeing with your tongue is possible by wearing a special helmet with a camera and an electric plate on your tongue that transmits low-voltage signals via the plate. The brain interprets this information through the visual cortex. The technique has also been used to help people with a malfunctioning cerebellum restore their balance. Story 13. The lead crime hypothesis suggests that there was a significant increase in violent crime in many countries between the 1960s and the 1990s, which later declined. This trend correlates with the introduction and subsequent removal of leaded gasoline. Various studies present a range of results on this topic. Story 14. It is really hard to drown in quicksand, but rather easy in a grain silo. Story 15. Transcranial magnetic stimulation for depression. I told my doctor it sounded like pseudoscience once a long time ago, but I later found out that it is a legitimate treatment. I have not actually undergone it myself, though, and I have heard personal reviews from both ends of the spectrum. Story 16. Mycelium. You are telling me the roots of mushrooms act as a large message delivery system that not only allows information to be sent long distances across a single specimen but can also be used by connected trees to communicate with each other and exchange nutrients. This is an oversimplification, and mycelium is not sentient like humans. However, I am not exaggerating how improbable it all sounds. There are some amazing mushroom documentaries, and it still baffles me. Story 17. Duct tape occlusion therapy. Basically, you put duct tape on warts for a few weeks and they just disappear. It sounds like the modern version of an old wives' tale, but it is a lot less painful than other methods, and a roll of duct tape costs practically nothing, so there is no reason not to give it a try. The questionable scientific aspect is that the research on it is limited. Not many pharmaceutical companies are researching the medical efficacy of duct tape, but the results are somewhat promising. There are 3 studies, all with significant methodological issues. A 2002 study found a high rate of efficacy, 85%, compared to 60% for cryotherapy, but it did not have a control group and gathered responses via phone interviews after the fact. As studies go, it is not the best design. 2 later studies failed to replicate the results of the first study, which is problematic for scientific validation. However, they tested clear duct tape, which uses a different kind of adhesive, rubber, compared to the standard gray duct tape, acrylic. This suggests that the adhesive type might play a role in triggering a reaction in the skin that causes the body to attack the wart. Additionally, one of the follow-up studies was criticized in peer review for making unsupported statements. Ultimately, there is a significant gap in knowledge, but there is some scientific evidence supporting the effectiveness of the therapy. Anecdotally, it has worked for me. I had a large wart on the bottom of my foot for years, and within a few weeks of using duct tape, it disappeared completely. Interestingly, I only treated the wart on the ball of my foot and not the heel, yet both healed at about the same rate. In summary, one study shows high effectiveness, and personal experience supports its use, although it still seems somewhat implausible. Story 18. I don't think this sounds like nonsense, but a lot of people I've explained it to seem to doubt me. Phantom pain due to physical opioid addiction occurs when you injure your back and start taking opioids. Your body learns that sending pain signals results in taking opioids. It becomes physically and mentally dependent on the opioids and continues sending pain signals long after the injury has healed. I was in a car accident and had to take opioids to sleep because my back would hurt after lying down for more than 4 or 5 hours. I also didn't realize the doctor my lawyer referred me to was more or less a pill mill. When I kept going in and saying I was still in pain, she just kept writing prescriptions. This was also decades ago when they were more liberal with them. I tried cutting down to half as much, and my back would wake up hurting worse than it had in months. It wasn't until I did some research on my own and found out about this that I was able to get off them. You basically have to tough it out for a week or two. Took 10 days and my back was very painful, but I've never had pain like I did from the accident again. I was probably on pain pills for at least a year longer than I needed to be. With all the talk of the opioid crisis, I can't believe this isn't discussed more. Story 19. It is not so much pseudoscience as it is good old-fashioned underfunding for research. Gut microbiome health is much more than just the health of one's gut. Story 20. Visualizing and mirror neurons research has shown that visualizing is incredibly powerful. It activates both motor neurons and mirror neurons. Watching someone perform a squat with good form and visualizing yourself performing the same motion with good form are almost the same to your brain as physically doing it. If you are working out or learning a dance, watch videos of other people doing it. Close your eyes and visualize yourself doing it, moving through the motion. When you go to do it, it will be easier. Story 21. Having blue eyes can make you prone to sneezing when exposed to bright light. Story 22. Some vertigo is caused by loose crystals in your inner ear, and specific head positional maneuvers can cure it almost immediately. It may sound unusual when explained that way, but the physiology behind it is fascinating. Story 23. It is surprising to think that cooling your wrist, behind the knee, or inside the elbow can cool the whole body because of the blood's proximity to the surface. Story 24. Hippies will tell you that you need to use lysergic acid diethylamide or psilocybin mushrooms to open your mind or heal yourself. Psychedelics, under an experienced guide, are approximately 66% effective at curing post-traumatic stress disorder in veterans on the first experience. Additionally, psychedelics are more than 50% effective at treating alcoholism, nicotine addiction, and other anxiety and depression disorders. Story 25. Quantum mechanics, especially antimatter and the way tiny particles appear and disappear. Story 26. Fascia. Biology and anatomy ignored it until recently, and it is probably the #1 cause of most general pain and aches. Story 27. I'm no expert, but this is based on my first-hand experience. Taking vitamin D supplements makes me feel significantly less depressed. I have the potential to be normal if I have consistently taken it. If I haven't, I will definitely be depressed even if everything else is going great. Vitamins are not pseudoscience. They are actual science. I had a hard time taking certain people seriously about them, but it does make a demonstrative difference in my life. Story 28. People with schizophrenia experience different hallucinations and delusions depending on their cultural background. For example, American individuals with schizophrenia are more likely to have fear-based experiences, while those from Ghana or Japan are more likely to have more positive experiences. Story 29. People pursue doctorates to study fossilized feces, also known as coprolites. When I first heard about it, I thought it was a joke. After all, isn't a fossil organic material replaced by minerals? So, what good would it do to study the size and shape of stone remains? However, it is a respected field of physical anthropology that has contributed greatly to our understanding of prehistory. Story 30. If you hold a pencil between your teeth, forcing your mouth into a grin-like shape, it will make you evaluate your mood more positively. Your brain responds to body movements and postures, and this way you can trick the brain into thinking you have been smiling all day. Story 31. Most of psychology and neurology seem unbelievable at first, but then there is a large amount of evidence supporting them. For example, with attention deficit hyperactivity disorder, a person with the condition might literally experience "my brain didn't let me do it." This is not false. It is related to executive dysfunction, where the brain does not know what or how to do something or to start and then simply does not. To an outside observer, it may appear as laziness, like the person is just slacking off, scrolling their phone or watching videos. However, inside, there is an ongoing internal struggle where the person is urging themselves to act but cannot. This issue affects not only important or menial tasks but also activities they want to do, such as playing a video game or reading a good book. It can often feel like locked-in syndrome, a condition where a person is trapped inside their own body as an observer. Story 32. Placebo effect. Your mind can genuinely heal your body just by believing it works. Story 33. When my son was born, one of his tear ducts had not opened yet, and his eye became very gunky. My pediatrician told me to put some breast milk on his eye periodically to keep it clean. It is also good for rashes. Story 34. Aphantasia. It is interesting how, whether you have it or not, you cannot understand how the opposite group operates. Story 35. Teratomas are tumors that can contain hair, teeth, muscle, and bone. Do not look it up or do. Story 36. The act of fermentation removes anti-nutrients. It may sound like misinformation, but in reality, there are many nutrients in your food that you cannot process because of accompanying anti-nutrients. Lactofermentation removes some of these and makes nutrients more bioavailable. Story 37. Ketamine therapy. Ketamine is often categorized alongside ayahuasca and other spiritually enhancing substances. However, ketamine and similar psychedelic compounds increase neuroplasticity in the brain, allowing you to overwrite certain habits. It is highly effective in treating anhedonia, post-traumatic stress disorder, and addiction. When combined with psychotherapy sessions, ketamine therapy can have a significant impact. There is strong hope for the future of mental health care. Story 38. The gut-brain connection is fascinating. The trillions of bacteria in your gut are communicating with your brain and influencing your mood and thoughts. It is not just trust your gut. There is an entire nervous system there. Scientists are exploring treatments for mental health issues through the gut. This perspective changes how you view your stomach entirely. Story 39. Eye movement desensitization and reprocessing is a therapy where you look at a moving light or object in the therapy room as you process painful memories, such as in post-traumatic stress disorder and related trauma disorders. It is very effective for most people and typically works faster than traditional therapeutic models. Sometimes the relief is apparent even after one session. It is broadly applied to conditions including post-traumatic stress disorder, anxiety disorders, phobias, and dissociative disorders. Eye movement desensitization and reprocessing is indicated for a wide variety of life challenges. Privately, I call it the little miracle. There are times when it appears to be almost mystical, but the human mind is vast and endless, and we know very little about it. Story 40. Using clove oil to treat mouth pain may sound like essential oil nonsense, but it works. About 13 years ago, I had my wisdom teeth extracted and developed dry socket in my 2 lower incisions. It was very painful and nothing worked. I went back to the dentist, and he packed the incisions with gauze soaked in clove oil. I had no belief it would help, but it really did. Since then, I have heard of clove oil being used to treat various types of oral pain such as canker sores and swollen spots. Story 41. Humans have patterns on their skin, similar to a cat's markings. The striated bands are formed in the uterus while the fetus is growing rapidly. Story 42. The double-slit experiment, where one particle appears to be in 2 places at the same time, is one of the most profound experiments in history. It is relatively easy to perform and has been repeated many times because it is unbelievable. If it does not disturb you on some level, you are probably not understanding it. Story 43. Time dilation occurs when time moves slower as you travel at high velocity or approach a strong gravitational field. Story 44. Cosmic rays, specifically neutrinos, are responsible for many random computer errors. The smaller the components and the less electricity they require, the more susceptible they are to interference. They carry very little electrical charge, but enough to flip zeros to ones. A single incorrect flip can cause temporary malfunctions. This is why turning devices off and on again often resolves many issues. Story 45. The perception of pain is modulated by your thoughts and feelings. In other words, you can use willpower to lessen pain, or more commonly in real life, you can distract someone to decrease their perception of pain. I always heard this concept in action and fantasy stories where a stoic monk-type character used mind over matter to overcome pain, although I thought it was just on the same level as chakras. Story 46. The month you are born affects your health for the rest of your life. No, seriously, look it up. Story 47. You get more nutrients from food the more you enjoy it. It sounds unlikely, but a study was conducted with 2 women. They were tasked with eating food from their own home country, food from the other woman's home country, and their own food blended into a paste. Despite both meals having the same nutritional content, the women absorbed more nutrients from their home country's food, less from the foreign food, and even less from the paste. Story 48. Not exactly what the thread is asking about, but a story that just happened. My wife and I were watching a true crime show on Netflix. A man was on the run from the police, and the police found a bag he had stashed. All the electronics were wrapped in aluminum foil. We laughed at it like, ha ha, aluminum foil conspiracy nut. My wife asked, would that even do anything? I said, no. Well, I guess it might make a Faraday cage to block signals. But there's no way it does anything. Does it? I grabbed some aluminum foil, wrapped my phone up, and yes, her phone calls no longer came through. So that's my answer. Wrapping your electronics in aluminum foil sounds like pseudoscience, but it does stop wireless connections. Story 49. I would add clinical hypnosis to this list. As a pediatrician, I frequently see children referred to me with various forms of chronic pain, with chronic abdominal pain being the most common. There is a series of tests and questions necessary to rule out more serious conditions like celiac disease, cancer, or even treatable ones like constipation. Once those are ruled out, clinical hypnosis can play an impressive role. Evidence shows that it can significantly reduce pain in many patients. This is apparently related to diverted attention and the resulting subjective difference between pain that happens to you and pain that you feel you have more control over. The latter is more manageable and causes less suffering. As a skeptic, I learned some techniques and tested them with my patients. In one particularly memorable case, a child who had daily pain for 7 years experienced pain that slowly grew milder and eventually disappeared completely within a month. 6 months later, there was still no pain. Story 50. The fact that oral health can be closely linked to heart health is important. Our friend has a child with a heart condition, and they need to go to a special dentist and have extra checkups to monitor his gums and overall oral health. Story 51. I'm late to the game, but I have an incredibly interesting topic. There is something called a flow state, and it is 100% real, verified, and reproducible. A flow state is something we have all experienced in our lives accidentally. It is that perfect level of attention where you dive deeply into what you are working on. Your attention and focus are dialed in to the point that the rest of the world fades out. Flow state even produces different brain activity than normal thinking. This is excellent for cultivating creativity and accomplishment. Story 52. There is an area of your brain that maps pain called the somatosensory cortex. You might think that larger organs take up the most space on the cortex, but it is often the opposite. Your hands and lips take up more bandwidth in your brain than other body parts that are significantly larger. The map of your body parts is mostly in order. For example, your hand is next to your wrist, which is next to your arm. However, the mapping also seems somewhat random. For instance, your genitals are mapped right next to your toes. Story 53. Not really answering the question, but related. Is lucid dreaming pseudoscience or real? I have seen some evidence supporting it, but it sounds like nonsense to me. Story 54. Aromatherapy can induce feelings of happiness and calm. It is not a substitute for actual medicine but can be used in conjunction with treatments. People who feel happier and calmer tend to have better outcomes. Story 55. Sociobiology studies how the degree of shared genetic background affects our decisions and behaviors. Researchers reviewed historical records from centuries ago. The amount of shared genes predicted with great accuracy who various historical figures would or would not kill. Story 56. Quantum entanglement sounds like pseudoscience, but it is actually a well-established phenomenon in quantum physics. The idea that particles can be connected across vast distances, instantly influencing each other faster than the speed of light, seems to defy common sense. Albert Einstein himself called it spooky, action at a distance. However, quantum entanglement has been repeatedly demonstrated in laboratory experiments and is a key principle in emerging technologies like quantum computing and cryptography. It is a perfect example of how the quantum world can be stranger than fiction, yet firmly grounded in scientific reality. Story 57. Sundowning is a phenomenon where the state of the brain changes as light levels decrease. For some people with dementia, once it gets darker or the sun sets, they may begin acting more confused or behave differently. It is both sad and fascinating. Story 58. A Formula One car produces so much downforce that it could theoretically drive on an upside-down road. Story 59. I guess electric shock therapy gets a bad reputation but is still used quite effectively in psychiatry. Of course, these days we sedate the patient before administering any shocks. Story 60. For anyone who does not ride a motorcycle, you turn in the opposite direction of where you want to go. If you want to go right, you press the handlebars to the left, and the bike leans to the right and turns in that direction. What you are doing is introducing instability to the forces that normally keep the bike upright, which are not fully understood. With enough speed and centrifugal force, the bike prevents itself from falling over. As you straighten the handlebars, the bike returns to a more stable upright position. This also happens on bicycles, but the effect is minimal at lower speeds and not as noticeable to most people. Story 61. A family member was recently experiencing vertigo issues. She told me she had the crystals realigned in her ears. My skepticism was high, but it turns out it is a real treatment. Story 62. Roundworms in humans can treat or prevent some autoimmune disorders. Story 63. Sniffing an alcohol wipe can temporarily help with nausea. Story 64. If a prepubescent girl is raised in a home with a related adult male, such as a father, brother, uncle, or grandparent, she will start puberty much later than if she is raised in a home with only an unrelated adult male. Women who are not taking oral contraceptives can detect the scent of a mate whose immune system is more different from their own. There is speculation that some women who take birth control, meet a man, marry, and have children may find their husband's scent less attractive after menopause when they stop taking birth control, especially if their immune systems are too similar. For this reason, it is recommended to stop taking birth control for a period to determine if they find their partner's scent attractive. The effect may be related to genetic differences rather than immune system differences. Story 65. It was found in a study that lucid dreamers could talk to researchers and solve mathematical equations. Story 66. Cranberry really helps prevent urinary tract infections. Note that I am not saying it cures them, but it helps avoid the bacteria that cause urinary tract infections to stick. It does not have to be cranberry juice. The tablets work just as well. Story 67. That lobbying by the American Heart Association to promote incorrect research linking red meats and cholesterol to heart disease helped sell vegetable oil, which led to a heart disease epidemic and a rise in cancer. The anti-fat narrative is not only incorrect but has caused the number of heart issues to skyrocket. Story 68. Eye movement desensitization and reprocessing therapy for mental health disorders. It utilizes bilateral stimulation, which may sound complicated, but it is not. You follow a light or the therapist's fingers back and forth with your eyes or do something similar, like tapping your left and right shoulders alternately. You do this while thinking of a traumatic or triggering memory or event. This process is supposed to help your brain reprocess the memory to be less distressing. The reasons why it works are not completely clear, but there is a significant amount of scientific evidence supporting its effectiveness. I have undergone this therapy for about 5 months, and it has been life-changing. Story 69. This is a great thread. Many things I have learned and experienced are already discussed here. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.